Agatin chitap kalenjin eng wui tugul ole imite itagat eng tetutiengung nebo tililindo rani. Kainenyu ko Chesankaro nebo Arap Sirma kimite ak ng'amutiot notok ko Raphael Muli ne inendet koboishe Principal Health Officer ak Secretary General nebo Kenya Environmental Health Public Health Practitioners Union eng Nairobi County. Ko inendet nekemite twai eng betut nebo rani akebendi keng'olole akobo koristo nematilil anan air pollution. So karibu sana mgeni wetu siku ya leo.
Thank you so very much.
You're welcome, Muli.
Asante sana.
Today we want to talk about air pollution, and because that is your field, we want you to delve into it and maybe tell us make us understand more. And before that, just say hello to our viewers and introduce yourself so that we continue.
Hello viewers, my name is Raphael Muli. I work for Nairobi City County. I'm a public health specialist. I am involved in matters to do with preventive medicine and public health to that matter. I'm also the Secretary General of KEFU. KEFU is a union of public health officers, and I'm the one representing the public health officers in Nairobi. Thank you.
Karibu sana. We are glad to have you today.
Thank you.
Now, let's delve into the air pollution. What is air pollution?
Thank you. Basically, air pollution is about emission of pollutants into the environment. And air pollution is caused by quite varied different sources that pollute the environment. So air pollution in a nutshell is the pollution of the air that we breathe in. And that is where we have a problem as far as matters concerning health are concerned. So we live in an environment which has different pollutants that pollute the environment, and some of those pollutants that are in the environment cause disease to human beings, and that is where we are having a problem, and that is where we need to put our energy to prevent the masses from getting sick. Apparently, issues of air pollution, many a times you do not feel the effect immediately. Some of them are long-term, but on a daily basis, we inhale air that is polluted by different organic pollutants that are found in the environment, and they are emitted by, like I said, various sources. For example, vehicles that we move with, they emit carbon dioxide. We have factories that are within our cities that also pollute into the environment. These particulate matters that are found in the environment, and we inhale. Some of them are very tiny that we cannot be able to see them with the naked eye. But I can tell you that on a single basis, we inhale some of these pollutants. And air pollution is vast because there is what we call indoor air pollution and there is outdoor air pollution. Yes.
For instance, when you talk about so many things that we inhale, must we smell something filthy for you to know that the air is polluted, or is something even odorless?
Quite a number of pollutants are odorless. You will not be able to smell them. But there are those that have smell, like methane gases. Those ones, they have a pungent smell. So you'll find some of these pollutants you can smell. Many a times as you walk in the streets of Nairobi here, you will be able to smell some of these pollutants, and especially when a vehicle is smoking or when you're in an environment where there is something that is burning, then definitely you'll be able to smell, and it can choke you. You'll feel the smoke around you, and that is basically how you can be able to feel and tell. But I can assure you, some of these particles are not visible. Some of them, you cannot smell them. but we inhale them on a daily basis. Yes.
Muli, when you talk about these pollutants like now, the ones which you can smell, how safe are we, and especially with the recent use of tear gas? What do you have to say about it?
Yes, like I've said, some of these gases, for sure, you might not even notice. As I said, as you walk around, you move around, you do your daily activity, even when seated in an office, many a times our windows are open, and those pollutants can be able to access. For example, when you're in the house and you're using the ordinary stoves that you used to use, some of the fuel that is used to light the stoves have impure fuel, which is pungent, and many a times we don't realize. You'll smell the smell, but it affects you, because when some of these pollutants get into your nostrils, they go directly to your lungs, and that is where they launch. And accumulation of some of these pollutants will be able to cause disease, because the body might not be able to remove all of them, because the body has a way of fighting any organic matter that gets into the system. But you'll find that those ones that get in and are unable to come out, and sometimes they'll launch in what we call in the alveoli and be able to cause ill health in human beings. Yes.
So this means that maybe the air is more polluted, like on the roads or something?
Yes, there are areas that are highly polluted, and most of the cities, because that is where we have many vehicles, that's where we have people smoking, because smoking also is a kind of a pollutant if you inhale it. This is where there's more concentration of people, and there are areas that you'll find the pollution is usually high. So, but you'll find there are areas that do not have so much vehicles, do not have that big population. So the pollution levels are a bit low. But to let you know, for Nairobi, we are sitting on a time bomb, and something needs to be done to correct the current status of pollution in this country, because a study was done by WHO, and it actually indicated 19,000 people die out of air pollution related conditions. That was a study that was done some time back in 2015, 2016 by WHO. Then you have UN report that says 13,300 people die out of indoor air pollution. So there are all these scenarios, and just to answer your question, is that for sure people who are living in cities are more exposed, including people who are working in environments that produce some of these pollutants into the environment. For example, you see a person working in a cement factory. That person is exposed to a lot of what we call fine dust, and if the person or the organization does not take the necessary action to protect the worker, then that person might not live for long, because on a daily basis that person inhales, and those things are launched in their lungs, including people who work in milling factories. I mean, there's always fine dust, and there needs to be what we call surveillance, and part of what we do is carrying out routine surveillance to educate the masses, and to also let people know that there are these risks that are within your working environment and can be able to interfere with your life or cause disease. And you need to ensure that you protect yourself so that you don't get some of these illnesses in future. Yes.
Thank you so much, Mr. Muli. How about the environment, the reserve environment, like the use of firewood and the dusty roads? How does it affect?
Yeah, that is part of pollution, actually. And that is why I said we are continuing to educate people. The firewood that we use at, at upcountry, that is a type of pollutants. We use firewood, it emits smoke. Have you ever looked at, those traditional houses of ours, and you look at the ceiling?
Yeah, it has tar.
Many a time it has tar.
Yeah.
So you can imagine if that is the status of the roof, and there's this person who almost on a regular basis, he lights that firewood and
cooks
stays there. So there's a lot of inhaling that happens, and that is why even our life expectancy as a country has gone down. So interventions are being made to educate people, to make people aware of what is happening. And I'm happy that Nairobi City County, through with the stewardship of His Excellency the Governor, he has put in measures, and we've been able to develop what we call air quality action plans. And he's also been able to set what we call a team that is involved in ensuring that we educate, we also come up with regulations so that we can be able to reduce the level of pollution in this city.
Now, as a public health officer, how does this air pollution affect us human beings?
Air pollution affects us. Like I've just said, there's the issue of disease. There's what we call lower respiratory conditions that affect us. There's the upper respiratory infections that also affect human beings. So there are a myriad of diseases. There is pneumonia. Some of them are carcinogenic, like the ones that are emitted by incinerators. And there are people living around incinerators. And some of the incinerators are not incinerators, because incinerators should be able to burn the waste into ashes. But you'll find incinerators that are producing smoke and polluting the environment and also causing risks to human beings. So we are also ensuring that Nairobi has proper incinerators that are meant for incineration of waste. And right now we are having more modern incinerators that are called microwave incinerators, which do not emit any smoke. So, and we have many other interventions, including better fuel efficiency cooking methods, so that they limit or we get out of the olden methods of using fuel that is causing pollution to the environment and to human beings. Yes.
Apart from the disease which you mentioned about, that is pneumonia, what other kind of diseases are most likely to affect the humans caused by this air pollution?
I talked about, apart from pneumonia and the rest, I talked about cancer. Cancer is very common, and some of the cancers that are there are basically caused by air pollution. There's the issue of eyes getting affected by pollution. You'll find itchy eyes, you'll find eyes that are affected and probably will need interventions. People also get irritations, body irritation and allergies due to some of these contaminants. Some people get an allergy or a skin infection because coming into contact with very harsh, hazardous material that you come into contact with, and you'll find yourself developing even a tumor just because of an exposure to air pollution. Yes.
How about asthma?
Asthma too. I mean, asthma can be exacerbated by when you come into contact with the same, and people really suffer, and they get perennial asthmatic conditions because of the environment that they're living in. Yes.
Mr. Muli, as you see patients, what are your statistics about these effects, these diseases? Do you see it affecting like women more or children?
Let me say that everybody is at risk.
Yes.
It's true that we have a population that is more at risk, and especially people, the young generation, let's say from 60 and below, that are moving up and down. But also the aging population, because we have them living in cities. I mean, they are equally exposed, including when I talked about indoor pollution, there are people also in the house, children, because if you use a fuel, a stove, that is causing emission of some of these pollutants, then the likelihood of even people living in the household level will also inhale and be able to get diseases or develop ill health. Yes.
Could you shed some light about these women who sell, not even women alone, there are so many people lined up on the roads selling their groceries. How risky, I mean, are they?
It is risky and extremely risky, because if you continue selling on the roadside, then you are exposed as much. The exposure levels are extremely high compared to somebody probably who is not working or selling at the roadside. So the risks of that engagement are high, and that is why the government is developing policies. One, to reduce the effects of emission of carbon dioxide. We have policies on the same. What needs to be done is enforcing. I know you've walked around and you've seen vehicles that have smoking. I mean, this should not be the case. In other parts of the world, I mean, they have tried to ensure they use more efficient fuel or other technologies. For example, for Nairobi, you're aware that Nairobi has started having the so-called electrical buses. This is a strategy, one of the strategies. We also have motorcycles that are using electricity. It is a strategy basically to reduce the number of motor vehicles and buses that are emitting the carbon dioxide. So it's a multiple varied strategies that can be used. So to answer your question, true. The people that are, on the roadside on a daily basis are very much exposed. I mean, and they are at risk, and definitely they possess the bigger burden of disease. Yes.
Has these measures, like the ones that you said about the electric motor vehicles, we don't see much of it on the roads. How effective or how far is it?
It has started.
Yes.
And I must say that the government is in the right path, but more needs to be done. One, at least we have electric-driven buses. We have motorcycles that people are buying now, vehicles that are, and that's the way to go. In other countries, they use hydrogen-powered vehicles that are not using the gas or the petrol that we use. So, and some of the other strategies is ensuring that some of the petrol or gas that we get from the fuel station do not have levels of lead, which when emitted also has its dire effects on human beings. Yes.
So the pilot projects, we could say, are happening in towns?
Yes, they are happening in cities. Let me speak for Nairobi, because I know that is where the burden is, because of the population that lives in Nairobi, the number of vehicles that are in Nairobi, the industries that are industrial areas and other parts of the town. So something is being done, and we are continuing to put in measures, and it's only policy and legislations that will be able to ensure that there's a tangible change. So we are at it, we are moving at it. For information, Nairobi has a team that was formed by His Excellency the Governor that looks into air pollution matters. So we are there trying to see what needs to be done, what changes need to be done, what modeling needs to be done, or what changes need to be effected for us to live in a healthy environment. For sure, it's not something that will happen tomorrow, but it will take a bit of some time, but definitely we'll be able to get there. We have started the process, and I believe we'll get there.
Do you have programs like reaching out with information to the people of the country as well?
Yes, but for your information, we are using the CHPs or CHVs. These are community health workers.
Yes.
And or volunteers or persons who are now, they have the education. And we've trained them, and actually right now the issue of indoor pollution is, they're creating a lot of awareness at that level. So they are going to homestays, just telling them the effects and what they need to do to ensure that they do not expose themselves. So, and I know it is across many parts of the country where CHVs are involved in this advocacy kind of an arrangement. Yes.
Are we looking at some programs like availing biogas or what for the people of country to utilize in order to reduce the use of firewood?
Yes, there is much that is happening.
Yes.
There is what we call, the government has actually partnered with, it's called modern energy cooking services that are now providing better solutions and better methods that can be used. And we have this program that is running in many parts of this country so that people can be educated, because when you have knowledge, then you know what to do and what not to do. Basically to ensure that we build a level of knowledge so that people can be able, in a very small way, be able to ensure that they curb, reduce exposure to pollutants in their environment.
Thank you.
Yes.
And how are you funding these projects?
We have partners
Yes.
that have come in. Nairobi County, let me talk of Nairobi County, has partnered with quite a number of non-governmental organizations, civil society, and like I said, there's a group formed that is dealing with issues of air pollution. There is one called Vital Statistics that is involved in the same, and then we have Internews that is also part and parcel of the stakeholders. Then we have World Resource Institute that are also involved, and other partners that I might not have mentioned here. Yes.
So, you have several partners.
Yes.
So at least you are hopeful that...
We are hopeful. We are hopeful, and the other thing that I also want to mention is that for Nairobi, we have what we call ground level monitoring. We have equipments that are strategically placed that will be able, that produces data on a daily basis on the kind of pollutants, be it carbon monoxide, be it sulfur dioxide, be it ozone. I mean, it records all those, so we are able to know which pollutants are in the environment. We also have what we call mobile monitoring kits, where they are mounted on moving vehicles and moving motorcycles, just to be able to capture the kind of pollutants that are in environment. This informs policy and be able to know what strategies that needs to be placed, so that we can be able to know how to deal with the different pollutants that are in our environment. Yes.
Meaning you have a whole lot of personnel working around the clock?
Yes, we have personnel. We have people that are dedicated to this. I can assure you we have a team at Nairobi City County, being part of the team that basically looks into matters of air pollution, and that is what we do on a daily basis. And like I said, the Excellency, the Governor Sakaja, is top on the list and ensures that he gets information, and he even pushes us to do what we can be able to do to ensure that we try and reduce the level of pollution in our environment.
So right now, you are able to know in areas what concentrates of pollution, maybe if sulfur is high or something, that's when you'll be able to address that, and especially like places like around the Nairobi River, the pungent smell you are talking about. What are you doing about it?
Yes, we are getting that information.
Yes.
Apart from even Nairobi River, we also have our dumps, the Dandora dam site, where produces what you call methane gases, and which is also a pollutant. I mean, there's that, and a lot is being done to ensure that first there's trying to reduce the amount of waste that goes to the dump site
itself.
About
yes.
part 62% of what goes to the dump site is illegal dumping, and strategies have been put. We have a strategic waste management strategy to ensure that solid waste is properly collected and properly disposed. Actually, what the county is doing is what we are calling segregation of waste at source. And that is a strategy that now we want to start building on, so that at your household level you're able to segregate what is supposed to be recycled and what is supposed to be taken to the dump site. And you'll find whatever is supposed to be taken to the dump site can also be an income generation activity for people to generate other products. Like the plastics that are found in our waste, like the glasses that are found in our waste, like many other wastes that we throw. But what we are advocating now, and we want to start for Nairobi, is segregation at source. So at your household level, you'll know where to put whatever is plastic, you'll know where to put where metallic,
wires,
so all those. So now when that is done, then part of whatever is recyclable is taken to the recycling plants. So you are left with what is producible, what that can be able to be taken or to a dump site. So those are some of the strategies that we are putting in place. So you'll find whatever is being taken to is very minimal at the end of the day.
Sure. Thank you so much, Mr. Muli.
Yes.
We'll take a break and then we'll come back. Chitap kalenjin kakekas kingolole akopo koristo onan air pollution, koristo notone makararan neneweche kakengalale ako ketesetai kingolole ko kinyoru kamunget kitikin asikeweke ketestai.